Morning. I'd like to welcome everyone to our 8th annual State of the Department lecture. This is something that we always very much look forward to, in particular because it's our first of 3 sessions with our general surgery resident applicants. We welcome you all. We're thrilled to have you here and look forward to a very exciting day. I think this is a great opportunity to talk about what has been a very, very exciting and I think pivotal year in the department. And let me start by a disclaimer that I think is very important. This is a report on the work of most everyone in this room. I cannot thank everyone enough for all of their tremendous contributions, their collegiality, their collaboration in executing the mission of the department. Our talk today is called Extreme Execution, and that's going to figure very much into some of the things that we talk about this morning. I apologize in advance for those I miss. It literally is impossible to talk about everything that is going on and everyone who is contributing. Please know that I have been thinking of you. We think of you always, and hopefully everyone will be sharing in those successes. And there's a lot going on. I hope I've gotten everything right. If I have not, please let me know, and please accept my apologies as well. Importantly up front, I think we're in a treat for some very special graphics today, courtesy of Scott Holmes, who is always there, so I hope you'll enjoy. And my special thanks to Scott for being my partner in this presentation, as always, and doing an excellent job. So here's the department in a glance. We are 15 divisions and sections, as depicted here, about 168 faculty number. That number seems to change on the uprise almost on a weekly basis. So the last accurate data is 168. The breakdown on professors, associate, and other ranks is indicated there. The total department now numbers about 550 faculty and staff. We see about 100,000 patients a year across our 5 different hospital affiliates, and we perform nearly 30,000 surgical cases annually. Importantly, and we're going to talk a lot about the contributions of the research mission, we presently stand at about $4.2 million in total NIH funding, and equally significantly, a record year raising $9.8 million. Barbara, short of $10 million, what happened to the other $200,000? But we're trying to be accurate, $9.8 million in total extramural funding, again, a department record. 120 residents and fellows, over 300 peer-reviewed articles, 8 residency programs, and 7 specialty programs, as shown there. Schematically, the department, again, is quite large, but I would draw your attention to several different areas. One is our education mission, led by Brad Scott and Holly Shillstone, very large group taking care of 120 trainees. Our clinical operations, which currently includes about 35 clinical staff plus 43 APPs. We're going to be talking about that in a bit more detail. Unique or relatively unique to our department is our communications office and our administrative oversight staff led by Renetta Etter and Susan Ressler, which are key components of the department's outreach, and we're going to be talking a bit about that. And of course, our research effort led by Scott Lemare, Vice Chair for Research, and Barbara Troutner, now supporting 56 research staff, which in turn supports our entire faculty, residents, and students in our research mission. So again, as depicted here, there's been tremendous growth over the last 7 years, from a nadir of 102 faculty in 2013 up to a current total of 168. This breaks down to about an increase of 30 faculty in the past 3 years, or 18%, and 33% increase in the faculty over the past 5 years. We are indebted and incredibly thankful to the college and the hospitals for their support of that increase in our ability to perform our mission. Equally importantly, in the last 3 years on the adult faculty side specifically, we had a 97% retention rate of our faculty. We've had 38 promotions in the past 3 years, a bit more about that in a few moments, but that has included 7 promotions to professor, 21 to associate, and so forth is seen there. The breakdown in this increase in faculty and their location is depicted in this slide, and as you can see in 2019, from 2015 to 2019, there was a 47% increase in the staff and faculty at Baylor St. Luke's, a 38% increase at Baylor proper, so those are the research and education staff and the like, and then a 51% increase in the faculty at Texas Children's. Amongst the recruits in the past year, two very prominent and important additions to our faculty, Ken Liao, who's our chief of the Division of Cardiothoracic Transplantation and Circulatory Support. Ken was recently bestowed the Lester and Sue Smith Endowed Chair in Surgery. Ken is the silent giant in cardiac surgery circles. He is so busy, or has been so busy operating, that he has never left the operating room, or so it seems. He really developed a reputation at the University of Minnesota of being really the foundation of their surgery program there. And through the recommendation of Gabe Lohr, actually, we're very, very fortunate to recruit Ken. We'll be talking a little bit more about some of his activities and the activities of the division in a few minutes. Equally significantly, Atif Iqbal. Atif Iqbal joined our department about 6 months ago as chief of colorectal surgery. He in turn has developed and is recruiting a tremendous program and is taking on additional responsibilities leading our surgical quality efforts over at Baylor St. Luke's Medical Center, and has really already in his first 6 months created pivotal changes to our colorectal surgery program that I think are going to be a tremendous foundation for future growth and development in this specialty. Other recruits over the past year are depicted here. Phil Carrott, we were fortunate to bring over from University of Michigan to help both on the thoracic surgery and lung transplant program. Dr. Yesenia Rojas Khalil came over from University of Louisville, who has the singular note. Hiram Polk, who is the chair at Louisville, stopped me and said this is one of the best surgeons he had ever worked with. Please treat her well. So that was a little daunting, but hopefully, Yesenia, we're off to a great start. Dr. Rojas Khalil is involved both in acute care surgery program and our colorectal surgery, working with Dr. Iqbal. Zach Pallister is one of a growing number of our own who we've been fortunate enough to bring back. And Zach matriculated both through our general surgery and our vascular surgery program, has joined the faculty of the department in vascular surgery. Dr. Julianne Lloyd joining the bariatric surgery program, Dr. Galina Toniva, another one of our own, joining acute care surgery. Another one of our own who were brought back is Dr. Orozco Sevilla, who was one of Dr. Caselli's fellows, went briefly to Miami, saw the light, and will be coming back at the beginning of the year to work with Dr. Provenza and Dr. Caselli in the cardiac surgery aortic program. 3 recruits over from Texas Children's as well. Dr. Harrahausen and Dr. Koshi, and in particular, Dr. Ed Hickey, who joins the cardiac surgery program and will be collaborating with in our quality improvement efforts. A number of other faculty, and I say that very specifically, and we are increasingly engaging with our APPs, and we're going to talk a little bit more about that in a few minutes. So our APP faculty who have come on board in the past year is depicted here. Supporting both our transplant, vascular, breast, acute care, and bariatric programs, as well as colorectal surgery. All great contributors already to the department. So let me talk a little bit in a larger view about what all of this recruitment has been able to accomplish for the department in a very significant way. Clearly, enhancing our diversity is a priority for us, as well as essentially all programs across the country. And I had looked at this a couple of years ago, and I just really found it very fascinating because this has all been very organic. We have not created any formalized or structured mechanisms to enhance our diversity, and yet here's the data from 2012 with our faculty of 100 to 2019. We've changed the dynamic very significantly from 42% white males to down to 34%. Again, we've done that largely through our recruits, and as you can see here, and as depicted in this slide, of our recruits, 36% were women, only 25% were Caucasian males. Again, this was not by design. This was, of course, finding the best people for the job, and I think it's been very comforting for us to see that we've been able to recruit such a diverse population or group of outstanding faculty. What becomes equally interesting about this is how it changes the dynamics of the department and also represents our ongoing challenges, which we're going to talk about as well. So in 2012, 36% of our faculty were Caucasian males. That has dropped to 18% at the assistant professor level. 30% of women assistant professors back in 2012. That has increased to 51%, again reflective of this recruitment. However, interestingly, but not surprisingly, representing the challenge, back in 2012, let me flip it around, only 2 of our 19 professors were women. That is now risen only to 3 or 9%. So obviously, absolutely no increase in the number of professors. That's not particularly surprising, since as noted here at the bottom, it takes 10 years to matriculate from the assistant professors, who are typically who we'd be recruiting, up to the professor level. So some real challenges in that regard. And we're going to talk about that a bit more in a second. Additional administrative staff that we've recruited across the board, including research, education, our communications group. Deb Sugarbaker in particular has been a tremendous contributor to our outreach program. And recently joining our bariatrics program, Jill Riley and Rachel Grease, and Chris Covington joining our outpatient vascular lab. We'll talk about that in a minute as well. Now, interestingly, as I was talking about promotion, you will notice immediately in terms of our promotions in the past year to professor, 3 out of the 4 promotions to professor were women. All 3 of our non-TCH faculty promoted to professor were women, and so of course this is highly encouraging, and really very pleased to see that we've been able to be supportive in this way. Additional recruits or promotions, as you can see, are Stephanie Gordy, Sean Groth, Nader Mazarwe, Ravi Ganta, and Sohail Shah. And finally, promotions from the instructor level to the assistant professor level, as shown here. A number of leadership appointments. I won't go through these in a particular detail, but significant advancement in the leadership of Ben Taub Hospital in particular, with the departure of Rob Todd. So Chad Wilson has become our new trauma director, and Eric Silverfine, our new chief of general surgery over at Ben Taub. Jeremy Ward had already taken over surgical critical care and will be advancing to be director of the surgical critical care program across the department. At St. Luke's, Rob Southard and Michelle Lohr have taken on leadership responsibilities for surgical ICUs. Louisa Chu has done the same over at the VA. Additional other important appointments is seen down here, including Christy Rialon and Marcus Hoffman, who have gone on to the curriculum committee of the college, which is incredibly significant and important to the college as well as the department opportunity. Many awards. This, again, as always, is only a small fraction of all those that we could have included, so I put this up for your notice. 2 of the more significant ones, including Dr. Silverfine and Dr. Maddox, now joining Dr. Wall in the American College of Surgeons Academy of Master Educators. This is an incredibly prestigious position and designation, which they both well deserve. And then on the right, Dr. Bill Fisher becoming another one of our nearly 25 fellows, the American Surgical Association, the most prestigious society in American surgery. Let me mention, in addition to our faculty awards, a number of resident student awards is depicted here, including across the bottom. 4 of our residents have won the ACE Awards, which is a St. Luke's Award for advancements of clinical excellence. And as noted previously, Dr. Iqbal is already making his mark, and not coincidentally, he is the mentor on 3 out of the 4 of these ACE Awards, developing clinical advancement over at St. Luke's, with Dr. Provenza being the 4th one. So congratulations, and tremendously positive sign in terms of the advancement and our recognition of our faculty, our residents, as well as our students. Perhaps not surprisingly or coincidentally reflective of these accomplishments and outside recognition, this past year we received our very first ranking and a relatively new recognition of departments of surgery, medicine, pediatrics, and major departments that support medical student curriculum. And we became first rank ever, number 15 for departments of surgery across the country. Interestingly, as much as we don't like rankings that are based upon reputation, this was actually all based upon reputation. This was a survey of deans and academic leaders of academic medical centers across the country. And again, as we said, we were ranked number 15, and obviously looking to even exceed that in coming years. Again, perhaps reflective of all of that relatively good news, this was the AAMC faculty survey that was conducted this past year by the college in collaboration with the AAMC. We had 97 respondents, which is quite good. And what is highlighted across the top is that our overall satisfaction was 84%, pretty good. There's always someone who is not incredibly positive and happy, I guess. But the good news is that this is in comparison to our cohort of other departments of surgery across the country, which was at 73%. The other numbers, as you can see there, job satisfaction 81%, compared to other clinical departments and other peer groups, other departments of surgery, 77%. Department governance, 80%. Collegiality, which again I think we all pride and treasure in our department across the college, at 84%, compared to 72% for peers. Focus on medical school mission at 82%. So despite the challenges, despite the things that we all would like to have better, I think some comfort and very good feedback in these metrics. So let's dig in and talk about our different missions, starting with our clinical mission. These, by the way, are Dr. Montero doesn't look particularly happy there, but he might have been one of the negative comments. But the balloons these are recognitions for excellence in clinical service. So a brief overview under the leadership of the Department of Surgery. We have a total of about 17 service lines and sections that we are responsible for and or lead. Two of the largest are Dr. Fisher, leading the very large surgery line. This is again over at Baylor St. Luke's Medical Center, and Dr. John Goss leading the transplant. But there are, of course, many other significant leaders, Dr. Mills, Dr. Liao, Dr. Caselli, Dr. Fisher, just to name a few. Some of the milestones accomplished by the department in the last year was our receipt of Bariatric Center of Excellence designation by the American College of Surgeons, a robust expansion of the robotics program. We'll talk more about that in a minute. And under the leadership of Sudha Chatterjee, a 112% increase in our ECMO survival over the last 4 years, and a 50% increase in our case volume. This has been very, very much under the radar, but a real recognition of and a real reflection of Shubha's tremendous contributions in developing a very high-end, very high quality, and very complex ECMO program. The growth of our program is seen here, 250% growth in case volume over the last 5 years. That had stabilized over the last year from 2018 to 2019, in large part, we suspect, because of the CMS review. We'll talk about that in a second. But as we'll also see, that those numbers are going up again, and we think we'll, with our new faculty that are really doing things seen nowhere else at the medical center, those numbers will continue to rise. Again, as I mentioned previously, we reflect 53% of the Baylor surgery volume, and 33% of the total St. Luke's surgery volume is performed by members of the Department of Surgery. Perhaps by no coincidence, the three areas where St. Luke's has achieved U.S. News and World Report designation of excellence in cardiac surgery, GI surgery, are all areas where the Department of Surgery plays a important role. One of the featured programs that we were tremendously excited about that was launched this year was a challenge to do something this different, but I think we're all beginning to celebrate this success. And we really are very thankful to Jim McDevitt and Joe Doty for having the foresight to support this mission. We've already done nearly a dozen cases and are booked up at a rate of at least half a dozen cases a week, is the OBL. So this is a completely different model at Baylor and Baylor St. Luke's Medical Center, provide great service for our patients, where for a patient who needs a peripheral vascular procedure, rather than needing to check into the hospital, they can actually get their procedure done right in the office, in an office-based model of care. This is obviously better for the patient. It avoids having them to go into the hospital. It's better in terms of patient comfort, patient satisfaction, and under the leadership of Chris Covington, who we were fortunate to recruit over from the hospital, from our good partners, the OBL is off to a tremendous start, and we actually think that this will hopefully be a model for other office-based procedures going forward. And there you can see the team there celebrating the first case. So a very, very exciting development in the portfolio of clinical offerings for the Department of Surgery. Shifting for a moment to our affiliates, it's also been a very, very exciting year for Bentab Hospital. A lot of things going on that we thought perhaps we would never see. In particular, as depicted here, a massive modernization and re-expansion of the OR and the emergency room services, including an absolutely beautiful second floor that includes 7 new operating rooms, a 34% increase in capacity, a $70 million modernization program that is coupled to a $25 million modernization of the emergency room as depicted here. Equally, if not more importantly, has been the improvement in quality metrics, or the success of quality metrics under the leadership of Chad Wilson in particular. And we also received a meritorious designation, which was received by only 58 of 708 eligible high-risk or eligible NISQIP hospitals, both in the high-risk and the all-case category. So again, tremendous accomplishments by our faculty and our leadership over at Bentab. Our other two major other two major hospital affiliates, obviously Texas Children's Hospital and the Michael E. DeBakey VA. In particular, with the recruitment of Chris Calderon about a year ago, the congenital heart program has absolutely gone through the roof, performing a record 1,100, I think it's even higher now, open heart procedures, never achieved those levels of volume, and reflective as well of the quality. The congenital heart program is ranked #1 in U.S. News World Report, coupled with the #3 designation for the hospital overall. Again, congenital heart program has STS 3-star designation, and really reflective of the entire pediatric program. Our colleagues over at Texas Children, just a phenomenal state-of-the-art hospital that I think we all can be tremendously proud of. The Michael E. DeBakey VA Medical Center continues as the largest in the country, achieving great successes both in terms of volume as well as quality. The only VA with an O/E ratio, so quality metric, less than 1 for 15 years. No small measure based upon that success in terms of quality. The past year we were designated for approval to open a heart transplant and mechanical circulatory support program, one of only about 4 in the United States, and we're excited under the leadership of Dr. Jimenez and Dr. Shafi to open that program in the coming year. The clinical mission continues and really in many ways starts in our clinics, and as a snapshot of that, I want to recognize the efforts of Anu Sudhakaran, Von Berry, and Jill Riley, who lead our clinics on the staff level. Because of their efforts, there's been a tremendous advancement of our efforts to support our patients, both in terms of quality, safety, and satisfaction. A lot of different metrics to look at. I won't go through all the details, but again, under Yvonne Anu and Jill's leadership, we are taking care of the patients, we are taking care of the staff, and hopefully we are taking care as the faculty as well. Doing everything from communicating better with our patients through AIDED and Communicate with Heart, a Cleveland Clinic program, but also taking care of the faculty and staff, including going to Astros games, hopefully not Game 7. And something that I really need more information on, the bariatrics axe throwing contest. We're not quite sure what happened there, but everyone did come back safely.
People should be scared of us, is what happened.
Okay, thank you for that. The Press Ganey, which is a challenging metric to beat, shown tremendous success, and just in the past month we achieved 90th percentile. The vascular surgery team achieved 90th percentile in terms of Press Ganey satisfaction, a great step forward. No small part, all of these are tied into our move to beautiful new facilities over at the McNair Center. The significant improvements across a number of different metrics over at St. Luke's, which have persisted. And I think with our continued effort, and the subject of the second half of my talk will continue. Much of that work has already begun, as depicted here. We have all been very involved in those processes, and again, I think we're very, very optimistic about what this portends for our clinical problems going forward. The other major component of our clinical development is our new association, not by our own measures, but what was going to happen on the other side of the transom, in that Catholic Health, which had been our corporate partner in St. Luke's, has now joined with Dignity Health to create Common Spirit, which is the largest, by some metrics, not-for-profit in the entire United States. So we are paired with a healthcare delivery network that spans 140 hospitals, $28 billion in revenue, 700 health facilities in 28 states, treating with 160,000 employees and treating about one-third of the U.S. population with access to Common Spirit facilities. So as Baylor being the only academic medical center in the entire Common Spirit Health Network, a tremendous opportunity for us as leaders to help develop and practice population medicine with our clinical partners. Let me shift gears again and talk about our education program a bit. Again, I think overall very, very positive and encouraging news. Some of the metrics are seen here. We, in the past year, have been increased to 9 categorical spots, which now has officially been transitioned into 4 clinical spots, 4 research spots, and a global surgery spot. More about this in a moment. Our applicants, medical student applicants, increased from 930 to 1422, which encompasses essentially almost all of the U.S. Graduates looking at surgery programs. Over the last 3 years, through a concerted effort, there has been, as depicted here, a significant improvement both in our entry USMLE scores, our ABSITE scores, which we'll talk about in more detail in a second, and perhaps most importantly, or equally importantly, a significant improvement in our ACGME resident survey results, including elements as significant as our non-educational obligations, fear of retribution, and the strength of our program evaluations. So honing in on this a little bit, and this is really the effort in particular of Neil Barshis taking on the reins from and assisting with Eric Silberfein and really creating a robust didactics program. Some of the data is presented here, including a very, very robust training sessions using a tool called TrueLearn, which is essentially a question bank. You can see depicted down here a significant correlation between ABSITE scores, which again translates into board pass rates, and the percent effort in terms of correct answers on this TrueLearn didactic bank. Very robust, again, educational didactic sessions. Depicted here is Stacy Carter, who is ranked the best lecturer or teacher in these didactic sessions. I hear that every time I speak to the residents and students, to the point where we've asked to stop getting Stacy Carter compliments. I can't take them anymore. But Stacy's, as many of our faculty are absolutely amazing, have created a tremendous change. Our ABSITE score is reflected here. Again, a indication of the success of didactic programs. The number of our residents scoring in the top 80th percentile on our ABSITE scores continues to climb. Perhaps more importantly, of course, is the number of our residents who score less than 30% on their ABSITEs, which is a reflection of potential failure on the boards, has decreased down to about less than 5%, which is a tremendous accomplishment, and again, a real kudos both to our residents for the concerted efforts and our faculty to get these numbers to where they are over a relatively short period of time. Dr. Barshis prepared this analysis of why these things are happening. Neil is a brilliant researcher, and he tried to explain this to me in an 8-paragraph email, and I lost him after the first paragraph. But basically what this, Neil, I don't know if you're here, want to get up and explain this, but basically the shift of this collection of lines from the left and top down to the right reflects really exactly what we would hope, that there's been a shift from a resident self-study, and this is a survey of the residents, to more of a didactic and learning on clinical rotation, which of course is an ideal metric that we've been looking for. So good news. Again, a busy slide. I won't go into a lot of detail on this, but this highlights other programs that help our residents and students advanced in terms of their education curriculum. It includes the leadership of the Sim Lab by Drs. Vera, Salas, Davis, and Hoffman, including robotics training and a very, very advanced simulated training, which we'll see on the tour this afternoon. A very significant growth of our robotics training program is depicted here, where now essentially all of our residents get SI, XI, and online training, preparing them for clinical rotations, led again by Dr. Chai, and now with the addition of Dr. Iqbal and Dr. Kai. And actually even a dedicated Saturday dedicated to robots training. Our residents are also equally involved in our research programs. It's a very, very important component of our education program. And it's depicted at the bottom right. This past year we were ranked number 3, a little bit competitive, I will admit that. So we're going to work on number 2 or number 1 in the Academic Surgical Congress. So just kidding, number 3 is very good, and we're very happy with that. But a tremendous accomplishment of our residents really achieving on the national level. In addition, this past year, we began matriculating our T32 scholars and our 2 current ones, Dr. Ryan working in my lab, and Dr. Kenning working over in with Dr. Najafi. So again, robust out-of-the-box efforts to improve and support our resident student education. Other programs that go beyond standard metrics and program development include our mentoring breakfast Big Brother programs, our notes program, which importantly was developed and continues to be run by our residents and is important inspiration of the second half of my talk this morning. Our new executive chief resident program, which brings up problems of significance to the chair's office to develop it on, and our leadership training program, which again I'll talk a bit more about in a second, which is a truly novel approach to develop resident and faculty leadership skills and ability to work and manage well in a complex organization such as ours. Our resident handbook, again, is somewhat of a unique contribution wherein all of the key protocols and procedures affecting resident performance are now codified and memorialized in this handbook, which is now into its second edition. Our global surgery program, which is really, again, reflective of how we have our residents who take the lead, is really the jewel of our education program. It is the only NRMP-listed global surgery program in the United States. Since it's the only one, even if with just one resident, it would be the largest, but with 6, it's even larger than the largest. And we now have residents going all over the world, as depicted on the bottom right, and including giving lectures. This is Dr. Vu and Dr. Davis over in Geneva at the World Health Organization. Time doesn't permit a detailed explanation of the global surgery program, but this is truly a crown jewel of what we are able to offer at the DeBakey Department of Surgery. Finally, in terms of our undergraduate education, we try to be as engaged and involved with our medical students as possible. Some of the programs and activities that we're especially proud of is our traveling fellowship program, which we just completed. Doctors to be Washburn and Jacobs, Emily Warren, and Dr. Navarro joined us at the American College of Surgeons in San Francisco as a way to reward and recognize their excellence and also help with our medical students getting more engaged and involved in surgery activities. Our laser program we'll talk about in a minute. And again, overall, through the leadership of Drs. Gordy and Cotton, our UME directors, are really a much more robust engagement with our medical students. And finally, our non-medical students, our undergrads, participate and matriculate into opportunities with the Department of Surgery through our long-standing DeBakey summer program, where out of about 200 applicants, we select 14 students, undergrad students from across the country who spend the summer with us in a tremendous program where these students actually get into the operating room, spend time with our faculty, and many of whom, including several of our existing faculty, actually go on to careers not only in medicine, but surgery as well. Our research and innovation mission, equally important component of our mission, and as I mentioned before, And depicted down on the right, under the leadership of Drs. Lemaire, Troutner, and David Ashton as our administrator, we've achieved record total funding of $9.8 million. This is in no small part been achieved and accomplished through the support of our Office of Surgical Research. Back when we started in 2012, the Office of Surgical Research could have been contained in a telephone booth. It was just Melissa Jackson, as depicted over there. And now we have about 56 research staff who support the academic mission or the research mission of our faculty. In 2019, that included the submission of 100 grant proposals worth a potential $66 million to support these research efforts, and as depicted in that other slide, now running 135 trials. The innovative aspects of our research program that go beyond the research component include a number of different collaborations that take advantage of this massive Texas Medical Center complex, and those include the SHARE program developed by Barbara Troutner, which is essentially an HSR or health services research, essentially patient outcomes and quality implementation program that has been developed in collaboration of iQuest, run by Laura Peterson over at the VA, which is the TAPAS HSR program in the Southwest. We now have 4 iQuest Share scholars, Drs. Laura, Rana, Sula, Burke, and Macris, representing all of our hospital affiliates, and they each have put together grant applications to advance their HSR research efforts. Equally importantly and exciting could be a talk unto itself, but just a snapshot because of the overview is our Instinct program, which is under the leadership of Dr. Kaur, has been designed as a incubator of ideas developed by our faculty, residents, and students that can be potentially matriculated or advanced into patentable, commercializable, licensable ideas, devices, products, processes that we can actually bring to patients. Perhaps a perfect example of this appeared in an outside publication. Dr. Kaur actually collaborated, and collaboration is a big part of what we do, with Mike Belford, who's the chair of OBGYN, to develop a very tiny suture device that could be used for fetal surgery. And finally, Rice University across the street, one of the premier engineering organizations in the country, is also a collaborator. In our Rice Seed program, we've now awarded about $45,000 in capstone projects to help support research efforts of our faculty, residents, and students, including Dr. Grogan's transoral dilator, and there's about half a dozen or so collaborations going on through speed dating programs with Rice faculty. iCamp, again, another program that is very unique to the Department of Surgery, this being led by Dr. Bijan Najafi in our Division of Vascular Surgery, which again uses collaboration across multiple specialties to develop advanced devices funded through a very robust extramural funding to help advance the care and support of patients with locomotor and or vascular diseases. Our grant awards in the past year are robust, as depicted here. I won't go through those in detail, but on some there was about $14 million in total new grants awarded in the past year. Journal publication, of course, consummately and correspondingly reflect not only a broad spectrum of publications, but a number in very high impact journals, including Dr. Maddox's participation in this New England Journal article about active shooter responses at healthcare facilities, and Dr. Grogan's really Landstone article in JAMA on transoral endocrine surgery. Our Seed Grant program is another opportunity for the department to support the efforts of our faculty and residents, or faculty and advanced practice providers, also part of our faculty, has included a total of about $340,000 over the past half dozen or so years, 17 awards, which is translated into about $1.2 million in awards. So the math on that, Mr. Doty, is for a $300,000 investment. We have a return of about $1.5 million in grants. So a 500% return on investment. If my 501 would do that well, it would be pretty good. So very encouraging component of our commitment and investment in the research enterprise. Finally, clearly important to talk about what we're accomplishing so the outside world has an opportunity to collaborate with us and vice versa. So under the leadership of Scott Holmes, Susan Ressler, Chad Wilson, and Sebastian Winokur on the faculty side, a very robust social media outreach effort is depicted here. We are ranked #1 in terms of Facebook likes, #7 in followers on Twitter. I am comfortable with this; it's okay. And #1 across the college in terms of Twitter followers. This is not as much as what we're sort of joking about it. It is actually truly impactful, and I do feel very strongly about this. Just in the past month, 68,000 impressions, meaning 68,000 people saw something that was going on in the Department of Surgery or our comments on what was going on in our community. A tremendous outreach and I think a tremendous opportunity for us to integrate with the community at large. Two quick examples. Dr. Mills recently became the first American to be on the European Journal of Vascular Surgery. Our comments about that, one story received 8,000 impressions, and Dr. Wilson becoming a trauma director received over 5,000 impressions. Very, very powerful tool. Other components of our outreach efforts are depicted here, everything from videos to a website design to blogs and e-news. And recently we've gone even further, becoming involved in Instagram and in a fascinating project that I don't totally understand. Our residents took over the American Society of Plastic Surgery Instagram and generated 142,000 impressions. I think that was in 24 hours, based upon their touring of the ASPS Instagram site. Really a very, very powerful tool. We also do traditional things like standard CME programs. This is led by Renata Etter, who has done a phenomenal job. In the past 2 years, there have been 6 such events that has included about 1,000 residents, $750,000 in revenue, 80 vendors, and importantly, access to about 8,000 people who we communicated with, physicians, scientists, students, residents, and the like, letting them know what's going on in our department. And finally, we reach out to the community in standard and non-standard ways, everything from our participation with middle schools in Stop the Bleed, a program led by Drs. Wilson and Gordy, Dr. Olier's efforts on Smile Train with national leadership in that. Again, of course, our association with the Association for Women Surgeons and our charitable efforts where a number of our faculty give up their day on a Saturday to operate at no charge. So very briefly on faculty and staff development, which really is the cornerstone of advancing all of our programs in a robust way under the leadership of John Goss and Renetta. We have a now very, very strong faculty appointment and promotions committee that has taken on everything as routine, as standard promotions, but now moved into things, areas such as advocating for faculty promotion, awards, and even membership in professional societies. And a very, very important component of our ability to support faculty beyond clinical activity is our academic RVU program. We've talked about that before. In total, over the last 4 years, there's been about $1 million awarded to our faculty for accomplishment that go beyond what's done in the clinic, research, education, professional engagement on the national level, and the like. Although this past year we were not able to do our academic RVU award because of making budget but not exceeding budget, we think with our budget targets for the coming year, opportunities to roll over the accomplishments of our faculty this past year into our FY20 awards look very good. So in the last 10 minutes or so, let me put all of this together, this very broad and robust portfolio of accomplishment, and talk about where this all came from. And since I've been here over the last 7 years, it truly has been a journey of 7 years. When we started back in 2012, there was a lot to do. The department was very fragmented. I remember when I was interviewing for this job, I asked Dr. Maddox what we needed, and he told me to bring us together, and that really was a tremendous focus over the last 4 years. It was an opportunity to grow. We faced the challenge over last year of what was going on at St. Luke's in the CMS visit. And again, I think 2018 are my Grand Rounds talk, and these are the Grand Rounds talks over the last 7 years. it truly was our finest hour. We had a challenge, we met the challenge, we overcame it, and I truly think we are far stronger for it and poised for going to the next level. That's important because this department, as we all know, truly does have a great and storied legacy. Some of the depictions of what Dr. DeBakey and the faculty and our staff in this department accomplished are depicted here. Everything from the first aortic aneurysm procedures, the first artificial hearts, Dr. Frazier's accomplishments in terms of VADS and the early stages of a heart transplant, even things such as the first satellite transmission of aortic valve surgery from right here at a Methodist hospital by Dr. DeBakey. And even in the plastic surgery world, the first silicone breast implant, which not well known, was actually developed by Giroux and Cronin, who were Baylor faculty members. So how do we take that legacy and move it forward? A couple of years ago, when we were thinking about how to accomplish that, I referenced this book, Good to Great. And the first thing that this book taught is don't worry about what you want to accomplish. The most important thing is have the right people working with you to do that. First two, then what? When you recruit those people, make sure you're thinking about being the very best that you can be. Transcend the curse of competence. Because if you can't be the best in the world, then what's the point of doing it, certainly as an aspirational goal? So we did that. I think we did that. We've recruited faculty from all over the country and even abroad, some of whom are depicted here. And we really tried very hard, and I think we've accomplished something in bringing in the very best, the brightest, the most committed physicians and scientists that one could ever hope to accumulate in one organization on one team. That was the work that we needed to do, and that was important because back in 2012, we only had a few pieces of the puzzle. But if we look at the department today, we really are a team complete. Whereas back in 2012, we had general surgery, cardiac surgery, a few other areas. Now we have all of the pieces of our clinical puzzle in place, and we truly are poised for that greatness that is part of the legacy of this department. This portfolio shares with you just a few of the legacy of the accomplishments, the landmarks, not of yesteryear, but what we do, what our faculty are accomplishing on an everyday basis. Again, this is an entire lecture, this one slide, but it's all here in one slide because it does reflect all of the things going on in the department. Everything from Dr. Liao's minimally invasive surgery, valve surgery, less than 20% of institutions in the country are performing it, to robotic cardiac surgery, the robotic thoracic outlet syndrome that Dr. Brian Bird has innovated and developed and has now become a world leader in this. Dr. Goss and his team performing their 2000th liver transplant. Less than 5 in the world have accomplished as much. Things such as an eye swap where 4 kidneys are swapped to maximize donations. Gabe Lohr's efforts now being translated even into land-breaking efforts to perform extracorporeal lung transplant to preserve hearts rather than putting them on a bucket of ice like you see in the movies. Now hearts and lungs can be preserved to optimize their availability for translation. Joe Mills is off giving lectures around the world because he's created an international standard for guiding diagnostics for limb preservation to minimize amputation rates. Ray Grogan's scarless transoral surgery. James Suleberg recruited Ray a couple of years ago, and together now they lead the world in being able to do thyroid surgery without a skin incision on the neck. James Suleberg, again, and Alistair Thompson and Stacy Carter's work in terms of mass spec pen. This has been in Reuters. The breast localization technique that they are participating in, again, is breaking all records. And finally, our development of new ERAS protocols, robotic use in colorectal surgery led by Dr. Iqbal, and robotics across the board. These are all milestones that few institutions, few programs can talk about. This only takes up one slide of this hour-long presentation. It is truly remarkable. I think we all take it for granted, and we do, and we should, but it represents a tremendous, tremendous foundation for doing great things and a reflection of the great things that we've already done. So we have the people. We've already accomplished tremendous things that any institution would be proud of. How do we go to the next level? The other book that I talked about a couple of years ago is A Team of Teams by Stanley McChrystal. It talked about solutions through ground-based interactions. It's not for the department or the chair or even the leadership of the department to lead and tell everyone what they should do, how they should do it. With the talent that we have in this room, that would be inappropriate and a true waste of talent and resources. It should be the other way around. We are here in a servant leadership model to help our faculty and residents and students achieve the things that we saw in that prior slide. So those closest to the problem, McChrystal said, armed by transparency and empowered by knowledge and availability, can execute in a way better than any leadership can. And that's what we are about, modeling this team of teams concept. The role of us all is to be cognizant of the culture, protect it, because this is the definition of a just culture that with the talent that we have in the room, we should strive to achieve and leverage and take advantage of. This past year, Dr. Suleberg and I wrote this paper really with the participation reflective of our entire department about how we take and analyze and understand human error and bad outcomes and take it from being something that's treated with a bias and as a pejorative and is supported and understood so we can do even better. So where does that take us? In conclusion, it takes us to this next concept that I would like to introduce to the department. And again, this was inspired not by someone from the outside, but was actually inspired by our residents. This book has been embraced by many of our residents. I first heard about it at a notes conference over at Ben Taub, led by our residents. And it takes the concept, this comes from the Navy SEALs, Jocko Willink, of extreme ownership, that each and every one of the very talented people in this room, the Navy SEALs of medicine and surgery, if you will, if we take each and every one of us take extreme ownership, we can accomplish great things. So what did Wilkins tell us in the concept of extreme ownership? Let's realize we're all human. We all make mistakes. There are no flawless performances. Let's acknowledge them. Let's check our ego. Let's operate with a degree of humility. And let's plan and develop a plan to overcome the challenges. Let's not be the tortured genius. We have a couple. We know them. They're never wrong. It's all everyone else who makes the mistakes. In the book, they say the rest of the world just can't see or appreciate the genius. Let's not have any of those tortured geniuses amongst ourselves. We all make mistakes, but we can all contribute and realize that we can contribute to support others who make mistakes as well. Let's focus and decisively engage. That's the credo of the surgeon. When Wilkins in the book talks about going into, and most of it happened in Iraq, he saw a combat zone in commotion. He said, you have a hell of a lot of battles going on. You have to stop back and maintain the strategic picture. A lot of challenges in a complex institution such as Baylor and Baylor St. Luke's Medical Center. If we determine the highest priority and focus our energies on it, whether it's a parathyroid hormone machine or getting a magneseed, and make sure we get it done, we will execute to perfection. Hold each other accountable. Each and every one of us need to hold the department responsible, the division responsible, each and every one of us responsible, the nurse in the operating room or the nurse on the floor. When we set expectations, if things are not to our expectation, say something. That can't be the standard. It may not get fixed immediately, but that's what we need to do. Wilkins said, looking back, I yelled a lot. I could have encouraged more. We're all trying. We're surrounded by great people. Let's support them. Let's set the standard high, but let's help all of us achieve this. And perhaps the most important of these slides, because it is reflective of a complex organization, we have to lead up and we have to lead down. Let's not talk about they as being evil or working against us. Let's understand that we're all trying to achieve in an imperfect world. So Wilkins says in his book, don't blame the boss. That sometimes might be me, so that's not self-serving. But look in the mirror first and examine what you can do to better convey critical information. If something is not working at the VA or in vascular surgery or in surgical oncology, don't assume that the person at the next level knows what the problem is. We need to share that information with each other. Speak up when it matters. These are all quotes from this book. But have the humility to understand and accept your boss must allocate limited assets make decisions with the bigger picture in mind. I want everything from Baylor St. Luke's Medical Center to support the Department of Surgery. We're not always going to get it. That doesn't mean we can't keep on trying, that we can't make our argument, and hopefully we will be successful. Over the previous weeks, Jocko, as the author of the book, had vented similar frustrations to me, probably more so than we should. We all have our moments where we want to vent in the best interest, we think, of our program, ourselves, our department, and the like. Let's remember to lead up and lead down. So where does that put us? What is our future? How are we going to take those lessons? Hopefully, if everyone agrees those are valid lessons, to realize our future. Well, the good news is Baylor has a robust plan in terms of strategic development of the research portfolio, everything precision medicine to population health, very, very significant and encouraging goals. In the Department of Surgery, under the leadership of Drs. Fisher and Awad, we have now self-assembled a quality council. Take all the brilliant talent from across the college and the department, the VA at St. Luke's and Ben Taub, share our ideas so that we can be leaders as an extreme ownership has been espoused, so that we can lead and share with others how we can do things better. Similarly, our advanced practice providers self-developed, and this is a recurring theme. It's not the department doing things, it's everyone in the department contributing and sharing and bringing to the table new ideas. So the APPs, under the leader of Holly Clayton, Phil Bowden, who developed an APP council, has already made tremendous contributions to advancing the clinical mission. Similarly, in our leadership development coaching initiative, which we started this past week, nearly 100 of our faculty and residents got to assess their own emotional IQ so we can understand each other better, to better engage with our colleagues and our partners in this department and elsewhere. This will be an ongoing series of workshops to make each and every one of us better performers and operators in this complex organization. Perhaps what I'm most proud of is our Social Equity Committee, which had its first meeting several weeks ago under the leadership of Michelle Lohr. Michelle and others said, hey, we're not so sure whether or not there's gender bias in the Department of Surgery, and I was pleased that we were able to say, well, let's find out, and if there is, let's do something about it. So we're looking forward for leadership from the Social Equity Committee to figure out and understand and dive in and come up with solutions how to make our department more equitable to the extent that there is an opportunity in our just culture. And finally, even at the level of our medical students and our residents, again, this is largely led by Denny Scaria, who has said, let's make sure that we're teaching at in the operating room and at the scrub sink, and make sure we all understand each other and communicate what our expectations are in our laser program for enhancing education in the operating room. So our goals for 2020 and beyond. We have our clinical components. We've done an amazing job self-assembling this group of talented faculty and surgeons. Let's take our research mission to the next level, be a Blue Ridge top 20, have the top funding in the country based upon more focused recruitments and building our infrastructure. Let's take our clinical quality to the next level. Let's be top 10% in Press Ganey and not settle for being anything less than that. Let's continue to support our residency training program. Our residency program is the heart and soul of this Department of Surgery. Let's be top 25% in AB sites, not just top 40%. Let's continue to be one of the top contributors to the American Academic Clinical Congress. Let's exceed national standards across the board in our ACGME survey results, and let's involve engagement and enrollment of our residents as students. Finally, let's continue to provide our faculty, trainees, and staff with fulfillment. Make this job meaningful. Let's make it that we look forward to coming to work every morning, which I think most of us do, and make sure we feel good when we leave at the end of the day. And finally, to do all that, let's be smart. Let's work effectively. Let's think about our colleagues at the college and the hospitals and work in an efficient way so we have the revenue and resources to support these missions. So in summary, let's not just have extreme execution or extreme ownership. Let's have, in this Department of Surgery, extreme execution. Let's do everything that we all have the talent and resources to do so we can continue on our march to making this department one of the very best, if not the best, in the country, if not beyond. So I thank you. I thank everyone for your contributions. I look forward to another great year with the Department of Surgery. Thank you.